2 mineral deficiencies that I think may be contributing to connective tissue disorders. As a naturopathic doctor who has read over 300 hair tests and work with many with MCAS, hypermobile Ehlers-Danlos syndrome, and autoimmune conditions, I am starting to recognize a pattern in many dealing with chronic illness. I want to share some of my insights and ways we may actually be able to help this population. And these 2 minerals may also help with hair loss, skin health, immune function, and overall longevity, so stick around. Many in my field are talking about the rise of hypermobility and connective tissue disorders. Some will say that we have better diagnostic tools and many in the past are being misdiagnosed, and I do think some of that is true. But what I'm seeing clinically is that many with hypermobility or hypermobility Ehlers-Danlos syndrome often was activated after COVID infection. And that is something I cannot ignore. And I have a theory on why COVID may be contributing to collagen and connective tissue issues. Something that makes COVID-19 different than other coronaviruses is that it does not just go after the ACE2 receptor in the lung, it also goes after the ACE2 receptor throughout the entire body, and that can include muscle and connective tissue. And because the virus has been shown to go after connective tissue and muscle tissue, what is happening is that the body needs repair molecules once the spike protein goes after these tissues and causes inflammation. So after the virus goes after the muscle and collagen fibers, it needs repair molecules, and minerals are a big factor. If the body does not have the repair molecules, the signaling minerals to properly repair and build collagen, I believe that this can lead to weaker, looser, more fragile connective tissue. One of the biggest patterns that I am noticing in chronic illness and long COVID is copper deficiency on hair tests. Hair testing measures the essential minerals and toxic metal accumulation within the hair within the last 2 to 4 months. And what I keep seeing on hair tests is extremely low copper, also an extremely high zinc to copper ratio, which confirms copper deficiency. I would like a zinc copper ratio around 7 to 9, and when it's above 10, I am suspecting a copper deficiency, and I'm seeing levels in the 20 to 30s range. And what this tells me is that the body is burning through minerals, antioxidants, and energy while trying to fight infections and maintain energy balance. And many of these patients have MCAS, chronic fatigue syndrome, and hypermobile Ehlers-Danlos syndrome. Copper is not just important for immune function, it is also essential and absolutely necessary for collagen and elastin synthesis. Copper is necessary for activation of lysyl oxidase, is involved in converting pro-collagen into collagen, pro-elastin into elastin. Without enough copper, you can see a decreased strength in blood vessels, bones, cartilage, ligaments, and even enamel of the teeth. These tissues end up becoming more fragile and more prone to damage. Copper is also involved in the extracellular matrix and cartilage, helping to transport and utilize nutrients within the connective tissue. And when copper is deficient, it can lead to reduced tendon strength, cartilage breakdown, and even early osteoarthritis. When you start putting this all together, you start to really see the pattern. Now, I want to make sure that you know that I do not recommend copper supplements without having a hair test first, because I also do see elevated copper levels clinically. And that can indicate to me there's liver issues, there's adrenal dysfunction that is occurring within the body, or the person can have really poor copper utilization. It's also important to note that iron and zinc compete for copper within the body. They bind to the same binding sites. And if you are taking a zinc or iron supplement, it could be worsening your copper deficiency. I have worked with many who've been taking zinc and iron supplements for years, and it can actually make iron deficiency worse because copper is necessary for moving iron. And yes, zinc is very important for the immune function, but it's also about balancing the copper in the zinc. Oftentimes when patients come to see me after looking at their hair tests, I often have to remove one or both of these supplements and put them on another protocol. Some other really important nutrients is vitamin C. Taking vitamin C away from a copper supplement can actually help to activate things like ceruloplasmin, which transports copper, and it also is an activator for lysyl oxidase, which is again going to activate the collagen and the elastin production. Sodium is another important mineral that needs to be addressed when looking at copper deficiency, because sodium actually helps to transport copper into the body and utilize it correctly. And oftentimes with chronic illness, I will see very low sodium, and that can contribute to copper deficiency as well. So it's making sure you're balancing both the sodium and the copper within the body. And sodium depletion is really common in chronic illness due to prolonged stress. The body ends up depleting potassium and sodium at extreme levels. So when I recommend copper, it is extremely personalized. I often recommend like 1 milligram to 5 milligrams depending on the person. I can give that patient maybe 1 dose a week to a daily dose, really depending on the severity of the copper deficiency and the sensitivity of the patient. When I recommend supplements and any minerals, it is always liquid form, unless I do a cell salt, which is like a tablet, it goes underneath the tongue. But I always go for liquids, and I would typically do cupric chloride. That is the most absorbable form that I've seen and most effective form that I've seen clinically to have substantial effects on someone's well-being. You may have also heard of GHK copper peptide, which is a collagen peptide that has gained a lot of attention for hair growth and skin health. And the benefits people are seeing are not just from the peptide itself, so the GHK, it is also because of the copper attached to that peptide. It is naturally found in the body, and it plays a role in tissue repair, reducing inflammation, activating collagen production, and upregulating genes that do all of those things. But something that I've noticed clinically, because many of my patients come to me already on peptides, that people who respond really well to this peptide often do have a copper deficiency. So super interesting that so many people are benefiting from this peptide and having new hair growth and skin benefits. And it could be just the copper alone that could be having these benefits, especially if someone's copper deficient. And people who are responding really, really well, I'm often seeing copper deficiency on their hair test. Copper is deeply involved in mitochondrial function, detoxification, energy production, and red blood cell production. Now I want to talk about the second mineral, and this mineral is never talked about, and we do not have any clinical testing to evaluate it, and you cannot find it on a hair test. So this is one of the most abundant trace minerals on Earth, and I believe it is one of the most overlooked in the human body. So this mineral is silica. So silica comes from rocks, and then from rocks it turns into dust, and it goes into our soil, into our water. Plants pick it up, animals then eat the plants, we eat the animals and the plants, and we should have ample amount of silica. But because of modern agriculture and purified water, we may be deficient in this mineral. And you got to remember, it's the second most abundant mineral on planet Earth. Silica has been used in homeopathy for decades, and it is known as a cell cleanser. It's used for things like body odor, constipation, dandruff, cracked skin, and brittle nails. Personally, I get silica through cell salts and an herb called horsetail, which is rich in silica, which I add to my sun tea every single morning. And I have a video on how I make my sun tea every day, so you feel free to check that out. And I've noticed major changes in my nail strength and integrity, and also body odor. But beyond that, I do believe silica may be a missing piece in connective tissue disorders. Silica has been shown to help with the utilization of calcium, copper, and magnesium. It also has been shown to enhance collagen cross-linking. It also promotes glycosamine glycans like hyaluronic acid, and that's why it's in a lot of skin and hair products. It can also improve tissue elasticity. And just like copper, it has also been associated with bone strength and density. It can retain up to 10 times its weight in water, which is incredible for hydration and cellular healing. When you look at plant structures, you can actually see the silica embedded in the cell walls, and it almost looks like a crystalline structure, and it's providing strength and integrity within that plant, and I believe it may have the same effect in human cells. I do wish we had better testing for silica, but we don't. And because we do not have any testing for silica, obviously I cannot test for deficiency. So when I recommend it, I usually try to focus on herbals and maybe implement orthosilica acid, which is the earth mineral form of silica. So my dosing has been off clinical response, intuition, and muscle testing. At the end of the day, while these minerals are extremely important, we also must look at digestion. If you cannot properly break down and absorb protein, you cannot build a strong collagen matrix or have healthy connective tissue. And that's always why I start with liquid supplements and liquid minerals in general, because most people with chronic illness are not breaking down properly and need gentle support. If you are a practitioner or a patient, I would love to hear your experience and your story. Have you noticed any copper issues, been on zinc or iron supplements for years, or developed symptoms of connective tissue disorders after COVID? The more that we share patterns, the more that we can actually help people. If you found this helpful, make sure to like, subscribe, or comment so that we can spread this knowledge to other people. Thank you for listening.